COVID-19 is a disease caused by the SARS-CoV-2 virus. In late 2019, it was discovered and has caused a major pandemic in 2020. One thing which is not discussed as much about the virus is that it can affect different groups of people in different ways and cause disparities. This might not be immediately obvious because you think, oh, a virus, it can't see, it can't discriminate, it should affect all people equally. And from a biological standpoint, this is mostly true. However, the social structures and systems that we have in place make it so that different groups of people are impacted more or less by COVID-19. There's four major ways this happens. The first way is there's a difference in access to care, especially in areas with a lot of inequality. For some people, there might be a less high-quality health insurance plan available, or even no health insurance. This can lead to more stress or even inability to access COVID-19 treatment. Of course, this will make the outcome worse. Moreover, there are risk factors which are higher in some low income and also racially unequal communities. This can cause more complications due to COVID because if the health is already lower in a certain community based on factors like obesity, diabetes, and other factors of long-term health, COVID-19 can exacerbate these underlying conditions and lead to worse quality outcomes. And this also affects different communities differently based on economics, race, and other factors which lead to inequality around the country and around the world. The third factor is that patients who don't, again, have the best insurance or don't have access to insurance might not even be able to get care for non-COVID related issues in the time of COVID. Because hospitals are overflowed, dense urban areas are susceptible to the problem that people who with lower quality insurance or people who don't have the access to multiple hospitals in their network cannot find any space in the hospitals for medium to low level ailments, which are still important to get treated, but are often cast aside now that it's the time of the pandemic. Lastly, the unemployment and the economic downturn caused by the COVID-19 pandemic and all of the problems that that has caused in the economy and in the structure of our overall workforce, that will lead to a harder time coming back to a point of having stable jobs and a more stable economy for those who are especially underprivileged currently, because they will not be able to easily go back to finding a job and go back to their old job, because for minimum wage workers, who, by the way, are also more susceptible to COVID because they're considered essential workers oftentimes and are more exposed to the virus. But those that were laid off, those who weren't have to face the threat of the virus, and those who were have to face economic stress and economic hardship. And afterwards, after the virus and after the pandemic, will also have to face the difficulty of trying to find a same job or an equal job afterwards. All of these factors contribute to COVID-19 causing and exacerbating inequalities which are already present. And this information comes from Dr. Essien, and it is part of the COVID course. Thank you very much. My name is Ishan. I hope you learned a lot, and you can comment below.